Voters in North Central Florida have one day left to decide the fate of Amendment 2, whether medical marijuana should be legal in the state.
And we've heard the pros and cons of the drug as a medicine, but what will happen here if the amendment passes? TV 20 Stephanie DiNardo explains why residents of North Central Florida in particular could experience a major impact.
I was diagnosed with cancer and had radiation treatment. And I had oxycodone prescribed, tried it, and hated it.
John Mills believes medical marijuana should be legal in Florida to give patients like himself an alternative to painkillers like oxycodone.
The last 10 years in the states that have medical marijuana available, there's a 20% reduction in deaths from painkillers and oxycodone.
Studies like this one, along with stories of patients with cancer and debilitating diseases, drove Mills to write Amendment 2 to legalize medical marijuana in Florida.
We all know someone who is either a parent, a cousin, or a friend who may well be in a condition that they could benefit by simply having the option.
With several renowned hospitals like UF Health Shands and North Florida Regional Medical Center, Mills says residents of North Central Florida could see a greater impact if the bill passes on Tuesday.
This area is a strong medical center. Therefore, there are more people in this population being treated for serious diseases, ALS, cancer, AIDS. We may have more people in this area who could be qualifying patients.
If Amendment 2 passes, legislators and the Department of Health must implement regulations and set up distributors of the drug within 6 months. The Department of Health would then issue identification cards to doctor-approved caregivers and patients with debilitating diseases. Opponents say they are concerned about the safety of the drug since it isn't FDA approved.
I don't think that the public is fully aware of what it takes to get a drug approved in this country. In this case, it's anything goes.
Mills says the state is already addressing this issue.
There would be a process for establishing who can provide a safe and secure type of growing facility, and the department and the legislature would look at other states where that's been successful.
Another concern among residents and law enforcement is how they would control the use and spread of marijuana, especially in a college town.
We in law enforcement are going to have to figure out what we're going to do. I mean, is it going to be okay to have introduction of marijuana by a student on the school grounds? Is it going to be a situation for the workplace?
Sheriff Darnell adds, with no specific guidelines in the amendment for law enforcement, it would be difficult to enforce the law.
To test the sobriety or whether or not somebody's under the influence is going to be very, very difficult from the get-go. There's also going to be the challenges within if any charges are filed, because there's been no case law set, no precedents that's being set.
Despite the concerns for law enforcement, Mills says this is an issue that isn't going to be voted away.
This definitely has all the characteristics of a movement. That is, there are people who viscerally, personally care about this, who know people and they're affected personally, and they're not going to go away.
Sheriff Darnell agrees with Mills that one day, if not tomorrow, medical marijuana will be legal in Florida. She says she just hopes law enforcement will be included in the discussion. Stephanie DiNardo, TV 20 News.